I'm Amanda, and this is my sister Paige, and today I will teach you the steps for how to check an ill or injured adult. Before getting started, it is important to check the scene for safety. If the scene is not safe, do not approach the person. You do not want to put yourself in danger. Call 911 immediately. This scene is obviously very safe, so you may approach the person. The first step for checking for an ill or injured adult is to check for life-threatening conditions such as unconsciousness, trouble breathing, absence of breathing, or severe bleeding. First, you must determine whether the person is conscious or not. First, check for responsiveness by tapping the person on the shoulder and shouting into their ear if they are okay. If you know the person's name, also shout that person's name. Paige, are you okay? Are you there? Paige, are you okay? Paige, are you okay? If the person does not show responsiveness and there are other people around, have someone else call 911. Unconsciousness is always a life-threatening condition, so you need to call 911 as soon as possible to get medical attention here quickly. If not, you must put the person in Haynes recovery position while you go to call 911. These are the steps for doing Haynes recovery position. First, lift the arm farther away from you over the victim's head. Then bend the knee closest to you so that the sole of the foot is laying flat on the ground. Next, while supporting the back of the neck, roll the victim onto his or her side so that the bent knee is touching the ground. Lastly, tuck the other hand under the chin. This is a safe position to leave a victim in if you need to call 911 because if he or she vomits, that person will not choke on their vomit. Now that the local emergency number has been called, you can put the victim back onto his or her back. Now you need to check for other life-threatening conditions such as a closed airway and signs of severe bleeding. First, you want to open the person's airway by doing the head tilt chin lift technique. Do the head tilt chin lift technique. Place one hand on the victim's forehead and 2 or 3 fingers on the chin. Push the chin gently up to move the head back. This moves the tongue away from the back of the throat to open the airway. Now you want to look, listen, and feel for signs of life for no more than 10 seconds. Nice. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi. Normal breathing is quiet and effortless. In an unconscious adult, however, you may notice irregular and gasping breaths. This is known as agonal breathing. This is not normal, so care for the person as you would for someone who is not breathing at all. Assume that the victim is having a cardiac emergency. Start CPR chest compressions immediately. 1 and 2 and 3 and 4. Person was in a drowning incident or has a known respiratory problem. Give 2 rescue breaths prior to starting CPR. These are the steps for giving rescue breaths. Do the head tilt chin lift to open the airway. Next, use your thumb and index finger to pinch the nose shut. If you have a breathing barrier, use it to create a full seal around the victim's mouth. Blow into the victim's mouth for about 1 second. Watch to make sure that the chest rises and falls with each breath. Give 2 consecutive rescue breaths. Review. Before getting started, check the scene for safety. Approach the victim only if the scene is safe. Check for life-threatening conditions. Determine if the victim is responsive. If the person is unresponsive, have someone else call 911. If no one is around to help, put the person into Haynes recovery position and then call 911. Determine if the person is breathing by doing the head tilt chin lift technique. Look, listen, and feel for signs of life for no more than 10 seconds. If the person is not breathing, assume that they are having a cardiac emergency and start CPR chest compressions. If the person has a known respiratory problem or was a drowning victim, give 2 rescue breaths prior to starting chest compressions.